Okay, Risperidone and the side effects. I said I was going to come back to yesterday, but I didn't. I had a long day. So I'm coming back today with Risperidone side effects. Okay, Risperidone sexual side effects. Yes, Risperidone can cause sexual side effects in both men and women, including men decreased libido, erectile dysfunction, renegade ejaculation, and in women, decreased libido, vaginal lubrication, and orgasm, orgasmic difficulty. Sexual dysfunction caused by Risperidone can be distressing and impact quality of life. In one study, 67.8% of people taking Risperidone for more than a year experienced sexual dysfunction. Reduced libido was the most common side effect reported by 60% of patients. One case describes a patient who experienced an important improvement in sexual function after reducing their Risperidone dose and adding a Abilify The other case reported de- describes a patient who switched from Risperidone to Lu- Lurisodone and experienced an improvement. I may have to switch my medication, reduce my dose because of my sex life. And now I know the cause of it. I can move in the right direction because it's affected me. It's affected me. That's what I do. This was February 23, 3rd. Uh, Sexual dysfunction is a prevalent side effect of antipsychotic medications, including Risperidone, and affects approximately 2/3 of men and women after 1 year of use. Risperidone is one such antipsychotic with a high reported rates of sexual dysfunction. Sexual dysfunction is the most frequent reported side effect of Risperidone, and most cited reason for non-compliance among patients. I read that part about men and women, the side effects. Supplemental treatments such as, I can't pronounce it, but I will spell it, SILDENAFIL, can be used to treat some of the sexual dysfunctions associated with Risperidone. Hey, Uno, what's the topic? Risperidone, sexual side effects. Good morning. Yeah. However, it's efficiently. Dang it. Can't stop yawning. However, its efficiency is treating sexual dysfunction caused by Risperidone specifically has not extensively been studied, and more research is needed to determine the effectiveness. Despite having a large impact of quality of life, sexual dysfunction is often underreported by patients and underinvestigated by clinic, resulting in medication noncompliance and worse outcomes. It is important to determine effective antipsychotic switching strategies and to keep in mind the sensitive nature of sexual dysfunction when asking about these adverse effects of these medications. Case presentation. Mr. W is a 55-year-old male with a history of bipolar disorder, type 1, and anxiety, who presented to our inpatient psychiatry facility due to a severe manic episode with psychotic features. The symptoms of mania started 2 months prior to hospitalization and gradually became worse. The symptoms included an irritable and agitated mood, a decreased need for sleep, a decreased need for sleep, an increased energy level, and grandiose thoughts. He also had psychomotor agitation with paranoid and delusional thoughts that people were out to get him. Good morning, Keep It Real show with the side of fake news. Good morning. Um, he started acting on his mood and psychotic symptoms and destroyed property and engaged in physical altercations during a comprehensive psychiatric evaluation. The patient shared that he stopped taking his prescribed Risperidone 2 months prior due to sexual dysfunction side effects, including reduced libido and ejaculation. He was still taking his other medication, which included amlodipine for hypertension, hydroxyzine as needed for anxiety, and nightly quetiapine for sleep and agitation. He had been following up with an outpatient psychiatric provider while experiencing these sexual side effects. Though he was never asked about sexual function or whether he was comfortable sharing this information at the time, his symptoms of bipolar disorder were stable on Risperidone 4 milligrams per day, 2 milligrams of Risperidone per twice daily. But due to the onset of sexual effects, the patient decided to stop only the Risperidone without informing his outpatient provider. He stated that the main reason for discontinuing the medication were the sexual side effects, which he claimed resolved in 2 months after he stopped taking Risperidone, but experienced bipolar symptoms. He had previously taken Risperidone during manic episodes many years prior to for an unknown brief duration. But could not recall if he had any adverse effects at the time. He also had he had also tried other antipsychotics such as quetiapine or Abilify previously, which were ineffective in controlling his symptoms. He also reported that during his current medic episode, he relapsed into using cocaine and cannabis off and on. Oh, wow. He had not used cocaine for a few days prior to the onset of manic symptoms, but relapsed due to his manic symptoms. He reported normal sexual function while off Risperidone, but on cocaine, so cocaine-induced sexual dysfunction was considered less likely. Still, his chronic cocaine use remained a consideration for his sexual dysfunction, and as shown to cause delayed ejaculation in men. The patient was a reliable historian, and collateral information was obtained to confirm his story. Damn, he got on cocaine too? Lord have mercy. So did it resolve his, so I guess when he got out the Respidone, it resolved his sexual dysfunction. And that's what I'm gonna have to do to get off of it. I'll still take the Zoloft, but I'm gonna have to get off I'm about to call my doctor and tell her that it's causing me to have sexual dysfunction. Um, Lord, sorry. Risperidone is characterized as a prolactin stimulating antipsychotic since it blocks the D2 receptors in this class of antipsychotics. The primary contributor to the adverse of sexual dysfunction. One study found that Risperidone produced higher levels of prolactin than other antitypical antipsychotics, and this this increased the serum prolactin with dose dependent. It's a blockage of 5-HT2A and 5-H2T2C receptors in the prefrontal cortex likely also contributes to the sexual adverse effects. Okay, so good morning, Tight Eyes. How you doing? Okay, so double blinded, 26 weeks, males and females diagnosed with schizophrenia or other psychotic disorder. 50% of initial optimal dose of Risperidone at 4 week. Reduction of enough optimal dose of Risperidone. And see, I take 2 a day. I take daily. I take one a day, daily. So it's 2 times a day. The only way I keep one of this cold in Tennessee. Oh yes, it's cold here too. It's very cold. It's like 20. Let me see. It's 30 degrees right now. 30 degrees. 30. So this is Mental Health Wednesday. Y'all expect to snow tomorrow or Friday? Tomorrow and Friday? Girl, I don't know. I don't know what's going on here. Ain't no snow came down yet. Ain't none came down yet here. So right now it's just cold. It's just cold. Oh no, you back. Okay, so I'm gonna talk to my doctors about my antipsychotic medicine that's causing me sexual discomfort, sexual dysfunction. I want to talk to my doctor about that. Once I go back to them, that's in February. This will be a touchy subject, but anyway, it got to come out. So they got to give me something that's not gonna affect my sexual tendencies. Yeah, we're gonna talk about that for real. It's something serious. I come and keep you warm. You can keep all us warm. Tyson can help you with comforting you. And I know, right? I need somebody to help me. Tracy will cause me. No, I won't. No, I won't. Ronnie is gonna whip your ass. Where is Ronnie anyway? I ain't seen Ronnie in a minute. She be running around here and every other step. I seen Ronnie went on to the lady Nika and said something and got blocked. Got timed out. She said something about Luther. Oh, she asked a question and that was it. She couldn't like it. Good morning, foot soldier. Good morning. How you doing? Yeah, this some serious. Good morning, Simply A. I want to know, do anybody else take this medicine? And does it affect y'all in that way? It's too cold to be having them kind of problems now. This is the time to borrow me until around March. I know, right? I need to borrow me. Yeah, it's an antipsychotic. Hmm. I never knew I had to go through this problem, but I am. It turns you into zombies. A zombie. No, it don't turn me into no zombie. It just mess with my sexual my I can't have orgasms because of the medicine. I can't feel shit. I don't need to feel like that. I'm good. Yeah, I don't take medicine. I already have a high testosterone. Wink, wink. Okay, I know you do. If you say you do, you do. Um, when I go back to the doctor, I'm gonna ask them to either take me off of it or wean me off of it because I don't want to just take myself off of it and have yeah take me off the medicine and put me on something else because it's really affected me. It really is. I ask about the hormone pills too. I know you do. I know you do. Oh no, I know you do. All right. Gotta make a phone call. I'm trying to listen to the list been working. Yeah, they gonna have to do something about this. Oh, so that's all I want to talk about today. Now let's see what else I can talk about. Anxiety. Anxiety. I know a lot of people out here have anxiety, deal with anxiety. Now they do have a alternative. This one is lucidodone, lucidodone, lucidodone. On the other hand, has not been associated with treatment related sexual dysfunction in a recent clinical trial. They mess with everything too, your receptors. Prolactin levels, profile, and reduce sexual side effects compared to Risperidone. One case study also showed a decrease in sexual dysfunction when switching to Risperidone from Risperidone. Maybe I have to ask them to switch my medicine. Take a picture of that so I can get a evaluate the medication. Because I've been on the medicine for a year. I've been on it for a year. That's good you're doing well on it's good you're doing well. If I could do well, it's for it's an antipsychotic, it's for bipolar disorder and schizophrenia. I have bipolar disorder. I suffer from bipolar disorder. But it's been doing good lately since I've been on the medicine. I have not had no manic attacks, no mania either. The fuck? You said Risperidone. It is Risperidone. It's called Risperidone too. Never knew you was bipolar. Yes, I suffer from bipolar disorder. I never knew either until I went to the doctor. I had all these side effects. I had all these things going on with me, and I didn't know about it. And now I know. I was taking Abilify for a minute. I was taking Abilify for a minute for bipolar one, but then I stopped taking that, and they put me. I've been on all kinds of medicine. I've been on Wellbutrin, Boost Bar, same thing, but that didn't help. Now I'm on Zoloft. It helps a lot. But my main thing I deal with, the main thing I deal with is back pain. Back pain. That's so that keeps me like bedbound. It keeps me bedbound, resting a lot because I can't do a lot of walking, not a lot of walking. Then when I do get the rest, I'm going to sleep, 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 sleep. But I still have thoughts about, someone told me yesterday, he was like, since I came in, he said, well, I know you must be rested right now. And what did he say? Hold on. Don't see what he said. This was yesterday. Oh yeah, he said, guess you must be tired. He said if I was there, I would give you a massage. And I said this right here, a massage will turn into something else. So I'm not fully I'm not fully dysfunction. I'm partial. Yeah, that massage would turn to something else. It really would. It really, really would. But be doing the huckabuck. It's like I don't have any desire. My desire is altered. And I don't like that. Then my back started. It's twitchy. Oh, we go to bed. Y'all can ask me any question y'all want to ask me. If y'all have questions. Questions? Waiting. Well, if you don't have any questions, I'm about to leave. All right, y'all. I'm finna go. Y'all have a great day. Bye.